Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about on hyperglycemia and how one should assess the risk about it. Yes, for this, I now welcome our expertise, none other Dr. Jai Aditya Ghoshji, who is our senior consultant endocrinologist from Yashoda Hospitals, Malakpet. I welcome you, Dr. Ghosh.
Thank you, ma'am. Thank you. It's a pleasure
And
to be here.
yes, and we are also privileged and honored to be with you for this discussion today. Yes, and I now request all our beloved speakers to introduce themselves. Yes, Tanisha, over to you.
Yeah, good afternoon, sir. Good afternoon, ma'am. My name is Chanisha, currently working as lecturer with the specialty of medical and surgical nursing in Yashoda Lakshmi College of Nursing. And I'm really excited and happy to be a part of today's webinar session. And I'm really looking forward for a great discussion. Thank you.
Thank you. Yes, Hima, you would like to say?
Yes, sir. Good afternoon, sir, and good afternoon, ma'am. My name is I am Hema from Kurnool district. I am working as community health officer, AP government. I am very happy and pleasure to be there after so long time after recovered from surgery. Thank you, ma'am.
Yes. Okay. So yes, this discussion is going to be very, very time bound because yes, the viewers, we request all the viewers to just post your comment and questions, while looking at the webinar. Yes. So, Dr. Ghosh, the first, query we would like to ask from your end is, what is the current status or diabetic scenario in India? What is happening? Is diabetes turning into a pandemic? Yes, over to you.
Yeah, so actually, diabetes is indeed a pandemic as of now. So, as per the International IDF Society guideline, 1/5 of the population of the worldwide population, like if we consider 100% people with diabetes, 1/5 of it has been contributed by Indian population in the total diabetes population worldwide. So, this is actually alarming. Over the whole 100%, we are contributing 20% of the total diabetes population. This is not a figure that we should be proud of. And the other thing is that regarding the percentage of patients among the patients with diabetes who are having a control in diabetes profile, in that
Yes.
the target that we want to achieve is a HbA1c of less than 7%, irrespective of, like, if we take on a whole, though there are certain parameters we look into while targeting the HbA1c as compared to the comorbidities, as compared to the age. So in that level as well, if we take an average HbA1c of less than 7%, it is actually 67% of the patients do not achieve this target. So 67% of the patients who are having diabetes, they are having an uncontrolled blood glucose profile. That is another thing that is also alarming, because one, the diabetes, if the control is not adequate, the chances of complications actually increases over time.
Yes.
So it is, and the most important thing, why is this happening? Because hyperglycemia sometimes does not give any symptoms, because hypoglycemia presents with palpitation, sweating, uneasiness. So patients are aware I'm having something, but hyperglycemia sometimes, like maximum of the times, if we talk about symptoms, 60 to 70% won't have any symptoms if they are having hyperglycemia until they have crossed a certain threshold for a longer period of time, when the body is already decompensating and not in an equilibrium state. So in that case only the symptoms develop. So that is the main problem why we lack good control. And the other fact being the increased prevalence of diabetes. This is because of the sedentary lifestyle, the food patterns, the daily lifestyle in terms of sleeping habits and daily routine habits that we have. That is the major driving factor being with increasing incidence of diabetes in India.
Very crisp update you have provided, and it is indeed surprisingly to know, as you said, hyperglycemia may not throw or exhibit any symptoms, but did, yes, hypoglycemia as well. Yes, going forward, we will also like to understand, like they are also interested to, clear their own insight from your end. Yes, yes. Over to you, Hema. Yes.
Yes, ma'am. Thank you, ma'am. Good afternoon, sir. Sir, diabetes and well-being. Hello.
Yes,
Yeah.
yes. Yes, we are you're audible.
Yeah, ma'am. How we find the early blood sugar levels, sir?
I can't hear
Early
you.
signs of blood sugars. Yes, sir.
Yeah, early signs, as I said, the signs of hyperglycemia may not be evident sometimes
Yes,
or in the
yes,
most of the cases, but some of the symptoms that the patients may have are increased urinary frequencies. Multiple times patient may have to go to washroom at night. That is nocturia may be one of the symptoms. One
yes,
other thing is that mouth dryness, feeling urge to have excessive water intake. That is also another sign of having hyperglycemia or increased blood glucose levels.
yes,
Third is some patients may have recurrent urinary tract infections. Urinary tract infections because of increased excretion of glucose. When the blood glucose goes high, there is increased glucose in the urine as well. So these people are prone for urinary tract infection. The third being recurrent skin infections. Recurrent skin infection in the form of some folliculitis, some fungal infections in the groin area, in the armpit area, or multiple follicles being folliculitis developing. So
yes,
these can be the symptoms. Obesity, sometimes uncontrolled blood glucose also leads to weight loss. So any without any reason, patient is having significant weight loss. That can also be a sign of hyperglycemia for a long duration. People have a notion that I will only gain weight if I have diabetes. That is actually a wrong concept sometimes. Weight loss can also be a manifestation of uncontrolled blood glucose for a longer period of time.
yes. So,
Yes.
yeah,
Thank you, sir. Thank you.
insight which I would like to also understand from your end is, like I've seen even your health talks and etc. Diabetes in the childhood and in the among the teens. So why is it rising? Like, what are the few
There
very
are,
yeah,
yeah, good question, ma'am. Very good question, because this is actually very important to know. The thing is that there is a concept known as anticipation. So if a patient develops diabetes at the age of 30s and 40s,
yeah,
so anticipation thing happens. Though, as we know, that type 2 diabetes has a very high genetic preponderance as well. If
yes,
both the parents have diabetes, there is a 90% chance that the offspring will also have a chance of diabetes. So
developing,
as
yeah,
the genetic preponderance is more, there is also a chance of anticipation. That means if the patient has diabetes at 30 to 40 years, the next offspring will have that disease 10 years earlier.
yes,
So that is the concept of anticipation, which is there in genetics. So
yeah,
that is one of the reason why, because earlier incidence was around 40s, 50s. So as the generations are going, the chances of having diabetes is getting earlier. The other thing is that the sedentary lifestyle, the altered sleep patterns, the stress level among the patients, the air pollution, and everything has an effect in the developing of early diabetes, because as the sleep pattern is getting altered, all the hormonal imbalances that creep up, the stress level, if there is a chronic stress level, there is a state of chronic hypercortisolism that may also persist underlying
yes,
subclinical level, that can also be there, which have with part to play in development. And other thing is obesity. Like in the
yes,
present scenario, as I had said, the lifestyle and hormonal imbalances ultimately leads to obesity. That is actually triggering insulin resistance and thereby ultimately culminating into development of type 2 diabetes
yes.
mellitus.
So, thanks for clearing this myth versus a fact about this childhood diabetes. Yes, and yes, Chanisha, over to you for your insight from Dr. Ghosh. Yes.
Yeah, yes, sir. I do have a question. So we usually hear this diabetes and all the time. So what exactly is this hyperglycemia, and how can we explain what hyperglycemia to a client who is approaching us?
Yes.
See, hyperglycemic blood glucose is there in our system. It is not a bad thing. Like blood glucose, if we talk about the term blood glucose, it is actually a normal thing in a patient. Every patient has a normal blood glucose level that should be maintained. So, what is the normal blood glucose level? So, it is actually we test it with certain tests. So, if we do a random test in a fasting patient, the target should be less than 100. In a after meal state, that is 2 hours after meal state, the blood glucose should be less than 140. And if we do a HbA1c, so what is HbA1c? it gives an average of the last 3 months blood glucose profile.
Yes.
So in that case, it should be less than or is less than equal to 5.7. So these three are the parameters which we look into it. So if there is increase in the blood glucose levels in the body, so why is this happening? Blood glucose level is increasing. When we take food, blood glucose gets absorbed. It is metabolized in the muscles or in the daily exercise, or it is stored in the liver in the form of glycogen. So once our metabolism system or our hormonal imbalance happens, this blood glucose that we are taking normally, that is metabolized or decreased with the help of insulin, is not getting metabolized. So excess blood glucose, extra blood glucose circulates in the blood. That is harmful. We have to, so the threshold is actually the important thing. Blood glucose per se is not harmful. Blood glucose levels above a threshold that I said has an impact on the body. So that needs to be taken care. And how to explain that a patient is having, like, what is hyperglycemia? So if, for example, if a patient is having a blood glucose level more than 200 at random also with symptoms, we can also state that the patient is having hyperglycemia. Okay. At any point of time, if the patient is having blood glucose of random blood glucose, maybe we did a blood glucose test and it is more than 200, then also it can be with in the background of having symptoms of whatever symptoms, as I said earlier. So that can also, we can explain to the patient that the patient is having hyperglycemia, apart from the standard readings of fasting more than 126, after meal blood glucose more than 200, and a HbA1c of more than or equal to 6.5%. So these are the 4 criteria by which we can explain to the patient that hyperglycemia is there.
Yes, Hema, I think the other all symptoms have been explained by Dr. Ghosh. Yes, you would like to take the insight. Yeah, over to you.
Yeah, sir. Any early signs and symptoms identification for the community people, sir? What are the main signs and symptoms of any warning signs, like 1 or 2?
Like you're trying to ask that sudden onset on symptoms.
Yeah.
Among,
yes, ma'am.
Yes, in the population, and what they should be looking for, Dr. Ghosh.
Mainly in rural areas, ma'am.
Yes.
As I said, some of
Yes, I think, yeah. Am I audible, Dr. Ghosh?
Your voice is audible for us, ma'am.
Yeah. Can you hear Dr. Ghosh's voice?
No, ma'am.
No, ma'am.
Okay. Okay, so we will just, talk under Dr. Joyce. And this is, I think we all have discussed this symptoms earlier. And, when Dr. Ghosh joins, he will try to, give us the insight about him. So, yes, Chanisha, what are your, doubt? We always keep looking at our patients, and a lot of sign symptoms that we get to see in the clinical scenario. Yes. Yeah, over to you.
Yes, ma'am. Commonly, we go with the 3 signs: polyuria, polydipsia, and polyphasia.
Yes, yes.
Which, like many of our elder patients who are not even having diabetes, like no history of diabetes, complain.
Okay.
In generally, the common signs, as per our knowledge, we can rule out that this polyuria, polyphasia, and polydipsia, as in excessive thirst, excessive intake of water, and excessive urination, will be the main signs which we see and complaints that we have from the community.
Yes. Yes.
Yeah.
Dr.
Can you hear me, ma'am, now? There was a network issue.
Yes.
Really sorry with that. Yeah.
Yes.
Yes.
Can you hear me, ma'am?
Hema. Yeah.
Yes,
yeah, Hema, you can repeat. Yes.
Sir, any sudden onset symptoms in community, sir? Any warning signs like that in community? How we can identify the sudden onset symptoms of rural population?
As I had said earlier, like you increased thirst frequency, increased urination, nocturia, skin infections, fungal infection. These are signs that I had already said. Apart from
Yeah.
that, there can be some symptoms of complications even at the starting, like even tingling sensation, burning sensation in the feet, maybe a warning sign. Even development of foot ulcers and delayed healing sometimes may be a
Yes.
warning signs. Sometimes hyperglycemia may be lead to vision problems because there is swelling of the lens, eye lens, because of the
Yes.
hyperglycemia. So there can be some kind of vision problems can also be there in the patients. So these can be the symptoms which we can ask if there is any burning, tingling sensation, if there is any vision problem, if there is any delayed healing of ulcers or recurrent ulcer formation, recurrent skin infections, urinary symptoms, and all those symptoms. Increased thirst frequency, sometimes increased food intake desire may also be there.
Yes.
So these
Yes.
are the because classically what we as rightly said earlier, polyphagia, polydipsia, polyuria. But
Polyuria.
polydipsia is a very vague symptom because polyuria and
Phagia.
polyuria and polyphagia, polydipsia actually is more common. Polydipsia and polyuria. Polyphagia,
Yes.
like increased appetite, is a very vague symptoms because it can be there in any person without having
Yes.
diabetes as per se.
Without, yes.
Whereas increased thirst as well as increased urination is a more specific symptom of diabetes.
Yes. So, yes,
Okay.
yeah. Tanisha, over to you. Yeah.
Yes, sir. So, sir, how can we like identify, as you mentioned, that we can identify the hypoglycemia with these symptoms, and what can be done if these symptoms are being identified initially? As in, like, if you are identifying it initially, is there any chance of preventing this going far to hypoglycemia?
See, hypoglycemia, if we want to prevent, it depends upon what the patient, if the patient is already diagnosed with diabetes and the patient is on medication and the patient is having symptoms of hypoglycemia, you are talking regarding hypoglycemia, right, ma'am?
Yes. Yes.
Yeah.
Hypoglycemia.
Uh,
Yes.
so if then it means that the patient is having an overdose of the medication, what the patient is taking, or the patient is having some other illnesses. Because of that, there is a increase dosage of the medication. For example, if a patient
Yes.
is having a good glycemic control and sudden onset fever was there or some illness was there during the recurrent period, and after that the patient is having recurrent onset of hypoglycemia. The symptoms of hypoglycemia are palpitation, sweating, uneasiness,
Yes.
dizziness, blackening, blackout episodes, and all those things. These are symptoms of hypoglycemia. So if these are there, we should directly consult the specialist
The
endocrinologist.
doctor. Yes.
So that the medication needs to be decreased, whatever the medication that the patient is taking at the present point, and also the patient needs to be evaluated for any other cause of hypoglycemia, like a recurrent illness, any renal dysfunction. Because if the patient has developed a renal problem which was not there earlier, there would be worse episodes of hypoglycemia because insulin that is secreted in the body gets excreted through the urine. So if there is in
Yes.
the creatinine level, the small amount of insulin that is produced will keep circulating, and that can lead to hypoglycemia. So
Yes.
this is also one of the symptoms, like patient developing renal dysfunction. Earlier, the patient was maybe not having that, may also have repeated episode of hypoglycemia. So if a patient is having hypoglycemia, we should tell them regarding the symptoms, as I said, and they should directly visit a physician or endocrinologist for dealing with the exact cause, whether is it
Yes.
just
Yes.
because of the drug overdose or patient is having an underlying concurrent infections or renal
Yes.
dysfunction.
Yes. So going forward, yes, I think yes, we now relatively a lot of myths and fact we get to see among right. So is eating too much simple sugar the main cause? Like now somebody who is non-diabetic and the sugar lovers, and they keep eating a lot of sweets and main sugar. So what is your intake on this thing? Yes.
Ma'am, there's a concept that eating only sugars can lead to diabetes, because I frequently get patients who said, I don't eat much, I don't eat sweets. So why am I developing diabetes, or why am my diabetes is not getting controlled? Why is it still uncontrolled? This is a very common question among patients, among common people as well. So
Yes.
it is not only taking normal sweets or sugars, even rice, roti, idli, dosa, whatever we eat, they have increased carbohydrate content. So the sugar content is already there. Even whatever our normal food patterns we have, like having rice, roti, idli, dosa. Idli dosa is also made of rice batter. Ultimately, the carb content is high. Even having high potato or having fruits in the form of banana, mango, custard apple, sometimes grapes even. So these have high sugar content. So increased intake of that can create an imbalance in the body. But the primary cause is not because of increased taking excess blood, these things. Ultimately, the inside problem that is there is because of insulin resistance first, and second, the beta cell dysfunction. That is, there's an organ in the body that is producing insulin. That is there in all the patients. That is producing insulin, and that actually decreases the blood glucose level. But what happens when a patient develops diabetes? Either the insulin that is produced by the pancreas is insufficient to control the blood glucose level, or the insulin that is produced is not able to act properly. So either there is a deficiency or a action deficiency. These are the two factors why blood glucose increases. So when we add on to that, if we take more amount of carbohydrate, then the body is not able to handle that in spite of that. So this eating patterns is actually a additive factor, not the main cause of developing diabetes. So the main problem is hormonal imbalance, that is insulin resistance, that happens because of obesity or genetic problem or certain other factors that play its part. But only eating problems may not solve it. Therefore, eating is actually a secondary factor. The primary problem is an underlying hormonal imbalance that is there.
Yes. Yeah, I think we have come to the end of the discussion, and the last slide you would like to take, Chanisha, and yes, then we end. Yes.
Yes, ma'am. Yes, ma'am. So can you please explain what are the strategies that can be used to prevent this hyperglycemia, specifically at high risk patients, or maybe before it is being diagnosed? And like any lifestyle modifications or any practical measures that can be taken to reduce the risk.
And especially one more, one thing also, even I wish to ask, like we see a lot of people, they walk in the mornings or whenever they get free. Nowadays, smart watches, everything is there in the place and they seemingly do good. I see a lot of our neighbors also, go for walking and all. So what is this like a fundamental of a little brisk walking? Does it help in, regulating the blood sugar or pre-prevention steps? Yes, over to you. Yeah.
So, this is actually very important, that prevention. We do not talk much about prevention. So prevention is actually the first step that should be inculcated in patients. And what we can do is, diabetes is actually a lifestyle disease, apart from its genetic preponderance that is there, but we can prevent it before it develops. So for that, lifestyle modification is very important. So 5 things that we can do is, first, exercise. If we tell how much exercise, we need to do at least 150 minutes of regular exercise, at least 5 days a week. So 30 minutes exercise is regular, needs to be done. That should be moderate to severe intensity exercises that needs to be done. So in that case, ma'am, as rightfully said, brisk walking or jogging, so that there is some sweating, so that there is some energy expenditure, calorie loss should be there. So that should be done at least 150 minutes per week. That should be minimum, not the uppermost limit. That can be extended as much as the patient wants. And that should be done at least 5 days a week, not skipping more than 2 days in a week. That should be done. Apart from that, yoga can also help in increasing the flexibility, having some improvement in the normal insulin resistance problems, as well as it also helps in decreasing the stress levels, like meditation and yoga. Because stress is also another factor that needs to be regularly modulated by the patient in terms of its lifestyle. So exercise and decreasing stress in the form of doing yoga, meditation, that actually helps in decreasing the stress level. Next, the food patterns. Dietary modification is actually the most important thing. So what we should do, we should decrease the quantity of carbohydrate that we are consuming. That is the
Yes.
quantity of rice, roti, idli, dosa should be minimized. Potato should be as less consumed as much as possible. We can increase the protein intake if you want. So what is protein?
Yes.
We know the non-vegetarian sources of protein like chicken, fish, egg, all those are protein sources. Apart from that, we have vegetarian sources as well. We have tofu, we have mushroom, we have soybeans. Soybeans is actually very good source of
Yes.
proteins. We can have dal if you want. We can have sprouts. That can
Yes.
be a good source of protein in the breakfast, because some people are only taking idli and dosas more in the morning. So we can shift those to having sprouts and all those things, which can impact in the long run, like decreasing the carbohydrate, increasing the proteins. Apart from that, we should also decrease the processed food, like canned food, outside food. So these things needs to be curtailed. So three things, as I've already said: exercise, stress management, dieting. Next come the addiction control. So addiction control means we should stop smoking. And earlier it was people were of the premonition that maybe alcohol was good, for some amount of alcohol
Yes.
may be good for health,
Yes.
but it is actually no. Now the guidelines state that strict no alcohol, no smoking, actually.
For those who are with the diabetes.
Yeah, for those who are diabetic,
Yes.
even for prevention, because
Yes.
smoking leads to oxidative stress, and that ultimately
Yes.
culminates in the development of diabetes, because that is stress is inflammation happens, and that can also. So these are the things, and also a good lifestyle. What do you mean by lifestyle? A good pattern or lifestyle, like getting up early, early to bed, because if we have dinner at around 7 to 8, because sometimes people have dinner at 10, 12 at night. That is actually
Yes.
detrimental for the body. Early dinner, like 6:37 should be the ideal time. I know in Indian scenario it is very difficult, but at least by 8 we should complete our dinner, so that
Yes.
there is a gap of at least 2 hours between our dinner time and sleep time. Because if we have a food at late at night and directly go to bed, the metabolism does not happen. It
Yes.
continues to culminate, and ultimately. And why to wake up early, and why is this concept of going for exercise early? Because all our hormones are at its peak in the morning. So
Morning.
if we have
Yes.
a good breakfast, we should eat more in the morning breakfast. The quantity should come down in the lunch, and it should be least at night. This
Yes.
should be followed, because this is in coordination with the hormonal profile that we have in our body, that is already systematically inculcated in every person out in the world. So hormones
Yes.
are at its peak. So at that time, the metabolism rate will be high. So at that time, the breakfast should be always never be skipped. That should be the
Yes.
thing. And so lifestyle in this sense, and using less phones at night, because that also hampers with our sleep patterns. Blue light,
Sleep pattern. Yeah.
bright light at night decreases the melatonin secretion, and that has impact on our sleep pattern. So if there is a
Yes.
problem in the sleep pattern as well, that also adds to the hormonal imbalance. So these
Yes.
five things: first, exercise; second, stress management; third, food patterns; fourth, addiction control; and fifth, daily lifestyle management in terms of eating habits, timing of eating habits. These things, these five things are the main pillars of prevention of development of diabetes in a patient.
Yes, that was very productive session. I know we cannot just bind this within half an hour because it is such a chronic condition and we got
Yes.
to know more and more about it. But thank you for your very productive insight on the same and we wish to learn more from your end and I
Sure, sure, ma'am.
thank you. And
Happy.
I, yes,
It was my pleasure actually being here with interacting with you.
yeah, thank you so much. And I thank the speakers as well. Hima and Chanisha. Yes, kindly like, share, and update for more views. You can we urge all the viewers. You can post your comments as well. We can just reply to them, and we end the session. Thank you, everyone. Thank you.
Thank you,
Thanks,
ma'am.
sir.
Thank
Thank
you.
you.
Thank you, sir. Thank you, ma'am.
Thank you.